All right, new at 5, some things you got for free during the pandemic, you will soon have to pay for now.
In just a few weeks, the 3-year-old federal COVID pandemic emergency declaration will end. And some local doctors are warning patients now about how you will have to pick up the tab for more.
Fox 23's Rick Marinon is live in studio after talking with some doctors about what they're telling their patients about the changes. Rick?
Well, COVID isn't over, but the free stuff is. Things like test kits, vaccines, and boosters, and even medicines to help you fight a COVID infection have been free since the pandemic began. But doctors I spoke with, as well as healthcare groups across the country, are putting out warnings that these things will no longer be free to you. A major policy put in place by then-President Donald Trump when COVID first came to America is ending in a couple of weeks.
We are better prepared as a nation and as a state, because we've been through a lot of trial and error in the beginning.
Since March 2020, insurance companies and the federal government have been picking up the cost for many things related to COVID. The feeling was the American people should be worried about battling COVID and not battling a big medical bill. But that's all coming to an end May 11th.
Now we're going to have people either not getting that testing done or not getting those medications, and that's going to increase the rate at which our population gets sicker.
Dr. Sharon Smallwood is president of the Tulsa County Medical Society. She says patients need to understand they will soon have to foot the bill for things like test kits, vaccines, boosters, and even certain antivirals. It will be up to insurance companies to determine how much cost they're willing to share, and in some cases, there could be surprises in future bills. There will also be some people who will lose part or all of their insurance because special policies keeping them from losing coverage during the pandemic will also go away. Dr. R. Murali Krishna says the number of underinsured in Oklahoma is likely to spike by a few 100,000.
Almost 950 million people are going to be uninsured or underinsured. That'll really be a big burden for them to receive care and for the providers to give the care.
Dr. Jean Hauscher with the Healthy Oklahoma Coalition says the healthcare system itself has changed for the better in some areas, but she too has concerns the poor will neglect their health because of the new costs.
Well, our hope is that some of the things will stay in motion, such as telehealth, which has evolved in something more stable and more affordable for people that can't otherwise necessarily get out.
It's not clear if your insurance company, Medicare, Medicaid, or CHIP will send you any information about coverage changes that will happen soon. If you can't find it easily online right now, you may need to actually call your provider for clarifications on certain policies. Live covering news that matters, I'm Rick Marinon, Fox 23 News.